Again, thank you, Dr. Stancic, for joining us after a screening of Code Blue. And we're starting the Q&A now, and I'm gonna jump right in. Compared to the time that the film was made, what kind of changes do you see like in medical education or in the attitude of medical schools to lifestyle medicine?
I think the wonderful thing is that we are certainly seeing this lifestyle medicine movement flourish across the country. We have had screenings at several medical schools. I think we're up to like 30 or 40 schools that we've had screenings. And the wonderful thing is that screenings allow us to open up this conversation and this dialogue. Some schools are not really familiar with lifestyle medicine and plant-based nutrition and really don't understand it so well. So it's wonderful when we reach those schools and we have some leadership attend, and then we can start having conversations. You guys are super blessed because you have Dr. Rosenthal at your organization who's such a leader in the community. But we hope to have someone like that in every medical school across the country to forge forward and create meaningful change. We really want those curricula to reflect these all important lessons so that each and every one of us, physicians in training, when you graduate, you have that tool in your toolbox so that, yes, you're going to learn all the important aspects of, the education model is built on this foundation currently of pathogenesis. So I always say to my medical students is when you go to medical school, the traditional medical school, the way it's built today is we learn to become really good disease detectives, right? We teach medical students the art of the, history taking and physical exam, and then we order labs and imaging studies, all in an effort to collect clues to create that differential diagnosis. And then once we have the diagnosis, we have our assessment and plan is a pharmaceutical agent, a procedure, or a surgical intervention, sometimes all of those. And again, all of that is important and it's part of what we should be learning, but that's only half of the human health continuum, right? The opposite of pathogenesis is what we call salutogenesis. And when I was there and visited with you in person, we talked about salutogenesis, and salutogenesis is the study of health and well-being. And that's the part we regrettably don't learn about in medical school. And it's such an important aspect. And so it was wonderful to feature a school like the University of South Carolina, Greenville, where Dr. Trilk and Dean Yuki, who founded the school, really wanted to build a medical school that was its foundation was this idea of lifestyle medicine and salutogenesis. And it was really quite extraordinary to meet medical students that grew up in this environment and how much, I think, happier and joyful they were. I think it's also important for us to recognize that our field, despite the fact that we represent health and well-being in society, we're a profession that is really struggling with depression and anxiety, and we have very high rates of suicide, which is incongruent with what we do. So I hope another aspect of this is assuring that we train in a fashion that isn't so stressful and so anxiety provoking, and that there's self-care, right? So one of the lovely lessons that I discussed with Dr. Trilk is when first day their first day at medical school, the first thing that she says to them is, you will be your first patient. So assuring that we're taking care of ourselves, right? That we're sleeping effectively, that we're eating properly, and that we're getting in that physical activity, because we want to be representatives of this ideal lifestyle for our patient population. And we know when we engage in these behaviors, our patients are more likely to do them as well.
Thank you. Oh, I have a follow-up. How can we reach, maybe as an interest group, as a student group, maybe students that don't have already an interest and aren't like interested to begin with? How do you we rope more people in?
I'm sorry, you went in and out. Can you repeat the question?
As a follow-up, as a lifestyle medicine interest group, like a student group,
yes,
what can we do to help reach more students that are not already maybe interested in lifestyle medicine?
Well, what are you doing now? Do you have events like maybe doing a culinary medicine class, bringing in a chef to share some ideas. We certainly tonight, hopefully we'll have some audience members that maybe weren't familiar with lifestyle medicine or plant-based nutrition, and you've had this screening at your school. Hopefully it was well publicized and maybe some folks came in. I think there's a lot of things like that that you can do. Membership at the American College of Lifestyle Medicine is a wonderful opportunity. Just going to their website, there's so many free and available resources there. The Physicians Committee for Responsible Medicine has tons of free resources. We have that nutrition guide that I shared with you guys. It's a free app that you can download, and this is what it looks like in hard copy format, but you can download this this incredible resource that is being updated every day. I can tell you that, you know, the bad thing about having a hard copy is that as soon as it's printed, it starts to become out of date. The electronic version, we're updating it every day. Like today, we're working on updating the COVID-19 chapter because there's research and studies that are being published every day, and we want it to be cutting edge. So that's the wonderful thing, to be able to download it through the app. We have a wonderful website, nutrition education.org, that is again free resources for. I think you can share those things, but I think what's most exciting about lifestyle medicine, and you witness this when you go to the conference. You have, and last time we had a conference, regrettably in person, was 2 years ago, or more, I think it was 2019. At which, by the way, we screened Code Blue for an audience of 3,000 physicians, which was really a highlight for me to be there and to watch the film being played at ACLM. It's such an inspirational conference. You get together with physicians from all over not just all over the country, but all over the world, who are really dedicated to this movement. Because right now we're sort of swimming upstream. It's not everyone, as you said, who has yet seen the light or is at least aware of this. So everything we do, when we hold a grand rounds, when we invite a speaker, Dr. McMacken is right in your neighborhood. I think she's now in a leadership position with the new mayor in New York City. I would invite her. She's a dynamic speaker. She was also in the film. You have Rob Osfeld, another superstar, who I know would come visit and offer a lecture. So introducing and bringing in these experts to talk about the power of lifestyle medicine in every aspect of, and every field, it's going to serve, I think, and lead to excitement in your community. I think medical students are really excited about this field because it truly allows us to address this chronic disease epidemic and really offer patients true healing and reversal of disease, which is incredible. I mean, I'm so grateful each and every day that I've now been living with this disease for 27 years, and I'm medication free and disability free. So I'm so grateful, and it's so important to me to pay this forward, because this should be accessible to everyone. And my quality of life is so blessed. And this morning I ran 5 miles, and I just feel so blessed and happy and thrilled to be with you this evening, because I know that all of you are going to go out into the world and practice medicine with this in mind, and you're going to be extraordinary physicians and really serve your community.
Thank you. Actually, we just reached out to Dr. McMacken today. So funny coincidence. Yeah.
Wonderful. Yeah. Well, she's fantastic, and I'm sure she's nearby. She's in Brooklyn,
Yeah.
I think. Mm-hmm.
We have a few questions in the chat. I can read the one from Jonathan Snow. Thank you, Dr. Stancic. The money aspect was brought up in the film, and I have a question about the business end. How do patients typically show up at your practice? Are they referred? Also, have there been any difficulties with insurer reimbursement?
Yeah, I mean, that's the challenge is reimbursement. The current models, as it stands today, the insurance model doesn't reimburse effectively for these services. And so but I can tell you that there are a lot of really smart people that are working on this. One of those people is Dr. Dexter Sherney, who is a previous president of the American College of Lifestyle Medicine. He's at an organization in Florida where he's actively working on solutions and working with insurance companies to assure that this preventive medicine model becomes financially soluble. And so there are challenges to the status quo right now, but I think we're well on our way. Many, for example, a lot of the services that registered dietitians would offer in the past were not reimbursable, and that's changed. There have been some significant changes in this past year, but absolutely, this is an obstruction to arriving at lifestyle medicine and preventive medicine being the standard and the norm. We need to modify the reimbursement model, and there's many ways we can do that. And it is something that is the American College of Lifestyle Medicine also has an entire division sort of dedicated to this effort.
Oh, I certainly agree, and I think it's a very interesting topic as to the financial solubility of a practice, and a practice that like yours, that's been going on for many years. If you can get something scalable like that for many practitioners, many people who desire to get certified in lifestyle medicine and turn this into and actually incorporate it into their careers, I think it'd be a wonderful and welcome change. So there's another question in the chat. Most of the colleges undergraduate in the US have health education classes that teach lifestyle change, nutrition, exercise for the individual as well as the community effort for lifestyle change for over 50 to 60 years now. So how is it going to be different? I think now the MDs are going to join this effort, and it will make a big difference in having people actually implement this effort and make a difference. Thank you.
Yeah, well, we're talking about MDs, but I think it's also important, and I just recently gave a lecture at a nursing school, but it's all healthcare professions really that as we work together. So I think it's important that we reach out to this multidisciplinary professional or multidisciplinary professional organizations and communicate these messages, because we want all individuals that are at any point there's a touch point with a patient. We want these ideas to be sort of repetitive and reinforced with every visit, right? So I think at the American College of Lifestyle Medicine has a nursing group that's very big and it's growing. So there's a lot of awareness. And I think the most important thing about lifestyle medicine is that it's most effective when there's a multidisciplinary approach. So ideally, it's the physician, the registered dietitian, the exercise physiologist, the clinical psychologist, that multidisciplinary approach that's most effective, because what we're trying to do, again, in the climate in which we exist right now, which isn't ideal, we're swimming upstream, and we're trying to introduce behavioral modification. We need that supportive network to get patients from point A to point B. It's a challenge, but it's becoming more accessible and more readily available because culture is shifting. There's definite movement in culture, and I think I think more and more individuals are becoming aware that dietary choice is incredibly important. I can tell you that the average diabetic has no understanding that their disease is reversible. They believe strongly that it's genetic in origin, and that if they're dependent on medication, that they will be dependent on medication forever, and that there's no the idea of diet and exercise and modification of lifestyle leading to a decrease in dependency on pharmaceutical agents or even potentially reversing the diabetic state is not something that that they believe is possible because it's just not been discussed or relayed to them by their physicians. I can tell you that, and this is hard to believe, but it's true. There are many physicians that don't know that to be true. I can't tell you how many times I've been giving a talk and, a student or even an attending physician raises their hand and says, you can reverse diabetes by changing diet and lifestyle. And we do it all the time. I mean, it's pretty commonplace.
I'm glad that you brought up the idea of nurses and other practitioners in addition to MDs getting involved, because certainly it is a team effort, and we want everybody to be on the same page when every step of the patient's journey throughout this whole process. And when you spoke about culture, that sort of brought this thing in my head with regard to patients that come to your practice. It's sort of like a multi-parter here. So, knowing that that patients of color are disproportionately bearing the burden of a lot of these chronic illnesses.
Yes.
And the other side of, food playing an immense role in, someone's cultural identity and such. I was wondering what kind of challenges, if any, you've had to overcome with your patients of color and dealing with different cuisines and making recommendations for modifications and things like that.
Yeah, I mean, it's such an important question. I mean, I tell my patients all the time that it's so important that we are true to our culture and where we come from, right? So a plant-based diet for me, I'm Cuban, may be very different than a plant-based diet for even my husband, who's Italian American. He has different culinary interests than I do. But every culture has ample plant-based options, right? That are so helpful. And so I think it's really important for us to be sensitive to that as to, what, and that's with my first visit, I would take a very thorough, dietary history and really understand where is that patient coming from? What are their likes and dislikes? And culture and ethnicity was a very important theme that we discussed in clinic. Now, I don't know if you guys are aware, but I'm no longer practicing. I closed my practice about 2 years ago. And I did that because I really wanted to dedicate the latter half of my career to really public health and sort of educating and bringing change to curricula and medical schools on a national level and even internationally. So that, but I did practice in a lifestyle medicine model for 10 years, and I learned a lot in that experience. I can tell you, and I think I mentioned this in the film, when I first opened my doors, no one knew what lifestyle medicine was, and I had 0 patients, but the practice grew really quite organically and even, and I don't know if I mentioned this in the film, one of the most amazing things about the practice that I could have not predicted when I first started was that by the time I closed my doors in 2020, I had about 60 patients that were also doctors. And the way that happened was at some point we had a patient in common. Like, here's an example. I had a diabetic patient that I was managing who came in with a hemoglobin A1C of 12, dependent on, I think, 3 or 4 medications, was hypertensive, hypercholesterolemic. And this person was really ready for change and was able to, lose significant weight, 80 pounds, I think it was. And we were able to taper off of every one of those medications. Hemoglobin A1C dropped to 5.5, so not even pre-diabetic. And now this woman had been diabetic for 15 years, and she returned to her endocrinologist for her yearly visit, and the endocrinologist was shocked by this immense change. And she said, well, what did you do? I went to see a lifestyle medicine doctor, an internal medicine doctor who's focused on behavior modification. And so the doctor calls me up and says, what are you doing? Is curious about. So I just shared what lifestyle medicine is. It's not alternative. It's not complementary. We're not using potions and supplements. This is just common sense. Optimizing diet and exercise. And anyway, she calls me up. We have this conversation. I send her a bunch of literature. And then she says, you know what, I want to come see you. And I thought at first it was like, we'll get together as two professionals, have a cup of tea and talk about whatever. And she said, no, I want to come see you as a patient because I'm carrying too much weight. I'm pre-diabetic and I'm hypertensive. I need your help. So then she came in and she became my patient and she changed her life. And that was amazing, because every patient that I care for is a privilege and an honor. But when I have a patient who's also a doctor and they create meaningful change, it affects their entire panel of patients. And that's what I saw. So all of these physicians that I was seeing, and I, internist, endocrinologist, I had a pathologist, I had a plastic surgeon, all kinds of physicians, and just seeing how they changed, how excited they were about learning this, not only for themselves, for their families, but then how it then led to change in the way that they practice medicine. And that's really, that's brought me so much joy because I know it's spread in the community. So yeah, I think lifestyle medicine and this idea of preventive medicine it has to come to the forefront. It has to be the future of medicine because the course that we're on today is not sustainable. Developing yet another drug to treat diabetes is not the solution to the problem. Diabetes, we're at about 10% of the population today, and the CDC is predicting that by 2050, more than 30% of Americans will be living with diabetes at the rate that we're at right now. Our healthcare system will implode. We can't do that. 2050 is not so far away. By the time my son's my age, so 2050. You guys will see 2050, and we have to act today. And that's what I'm comforted by knowing that you are the future of medicine. And I know that the way we deliver care and our relationships with our patients are going to change because the path that we're on today is not working. It's not sustainable. And, we're living in the midst of this COVID-19 pandemic, and we've witnessed how this chronic disease epidemic has intersected with this acute infectious contagion. We've known very early on, we learned that if you had a chronic disease at the time you were infected, you were 6 times more likely to be hospitalized, 12 times more likely to die. In November of 2020, a large study published showed 900,000 hospitalizations, and 60% of them were in patients that were either obese, diabetic, or hypertensive. So we know that this COVID-19 pandemic has really shed light on how vulnerable a community we are. And so my prayer is that the silver lining of all of this is that it serves to awaken us as a society of healthcare professionals that we need to change. And I think we need to change starting with ourselves, the man in the mirror. We have to be responsible and be the example. And I think if we do that, we will create that meaningful shift in society.
Well, thank you for that very thoughtful answer. Just wondering if we have any more questions. Anybody?
Anyone in the? We have one in the chat. I like how lifestyle medicine empowers patients and is adaptable to each person. For people with limited movement and may have not been able to make much physical activity, I think whole food, plant-based nutrition and meditation are great to prevent chronic diseases. What other aspects of lifestyle medicine would you suggest to this population?
So lifestyle medicine, there's 6, I guess some people refer to them as pillars. I use a wheel with 6 spokes. And the reason I use the wheel is because I like the imagery of those spokes sort of being interdependent, right? So if you could imagine a wheel, and let's say you had 4 good spokes, but you had 2 weak ones, your forward movement wouldn't be very effective. So that's the imagery that I use. I use that in my book, and I use that with the patients because I would have often patients that were really good with their diet and really good with exercise, but then they would drink too much, 3 or 4 glasses of wine, and then they wouldn't sleep very well. And so, in order for us to achieve our best, our optimal self, meaning that what can we do what do we need to do to address every aspect so that we can reduce our risk of developing disease? So, of course, it's our diet, it's our exercise, it's our stress, managing, assuring that we're sleeping effectively, addressing substance abuse issues. And then the 6th is social interconnectedness. There's lots of evidence in the literature about the importance of avoiding isolation and depression and how that fuels chronic disease and premature death. So I think all of us are probably really good at 4 or 5 of those spokes. So whatever weakness you have, and we all have them, bring attention to that one. Do yourself a favor and work on that one, because when you can address all 6 spokes simultaneously, that's when you're going to achieve your sweet spot and live your best self. And that's what we want. We want everyone to live free of chronic disease. And as I always say, my hope for each and every one of us is that on that last day on planet Earth, and there will be a last day because we're all going to pass at some point, but on that last day, I wish for you a beautiful day with your family, surrounded by those you love, free of dementia, and that night you go to bed with a smile on your face and you pass away peacefully with dignity, and not regrettably what we see so often today, patients passing in nursing homes or in ICUs, or that bookend of suffering. That's what we want to prevent. We want individuals to pass away in a fashion as I described. I mean, that's what I hope for each and every one of us.
Oh, that's very beautiful. Thank you. Any other questions? You can also unmute if you'd like. I had a kind of a silly question, but what do you say to someone that likes to say, but if there's no fat or salt in my diet, what's the point in living? Do you ever talk to people like that?
Yeah, all the time.
Yeah.
Yeah, I think our taste buds become acclimated to what we're eating. So regrettably, if you go to most restaurants over salt things and they add so much oil to everything, and so that's what we become to know as what we enjoy and is delicious. I remember, I used to eat years ago cheeseburgers and enjoy them. Now my taste buds have been modified, and I would never eat that, and I would have no interest in it. The foods that I eat are so beautiful and so delicious, and I enjoy them so much. I think what people don't realize is that they don't know what they're missing out. And I would just say to them, just try it, give it a couple of days, experience something, put yourself out there and know. And why would you want to try something? Because what this offers is extraordinary. The idea that we could, by the decisions that we make, of what we put on our plate, that we could reduce our risk of all these chronic diseases. I mean, you guys are witnessing in the hospital patients coming in with diabetes and heart disease and all of the suffering that they're experiencing. And it's not just them, it's their family members that have to witness it, so that you can live a joyful life free of having to take medications or being hospitalized. And I think it's so well worth it. But I think most people still today do not connect the dots between dietary choice and all of these chronic diseases. And that's our responsibility, to assure that they understand that even in the COVID-19 pandemic, where we've done an extraordinary job with educating the public. I'm an infectious disease physician, so just getting doctors. I remember when I was an infectious disease fellow and a young infectious disease attending, trying to get doctors to wash their hands. That was, a hurdle. and making sure that they didn't overprescribe antibiotics. We had this whole antibiotic resistance program and trying, but, we've done a lot of education in terms of, transmission and, why we wash our hands and why we wear a mask and, 6 feet distancing. So the American public has gotten really a lot of education on infection control measures, which is great. But what has been missed by public health officials, and it's again regrettable that we haven't talked about the importance of, in the midst of this COVID-19 pandemic, eating healthfully, exercising, addressing cardiometabolic diseases better, because it's clear that we know that patients who have these cardiometabolic disorders, obesity, hypertension, that they're more likely to have severe COVID, and they're more likely to even die from this disorder. So I think that's been a missed opportunity by public health officials, both at the federal level and state, county, local. I'm always pleased to see an article that's published about this, and they're starting to become more prevalent. But I wish, like Dr. Fauci, would take an opportunity, have a press conference and talk about the importance of diet and exercise, managing stress and sleeping effectively, and alcohol consumption. All of these things have certainly contributed to worsening outcomes with COVID-19.
Yeah, thank you so much. If there are any other questions, I think we'd like to sign off, and thank you again for.
Thank you so much, guys. Have a wonderful evening. And again, thank you for holding the screening. And it was really wonderful to talk to you today.
It was great. Thank you for returning to Downstate.
Yes, absolutely. And hopefully I can come back again. Please invite Dr. McMacken. If she comes, I will come visit her.
Okay, all right. That sounds good.
Bye-bye.
We'll keep in touch. Thank you.